COVID-19 infections in the Australian state of New South Wales have hit their lowest level in nearly a month. But officials say that the outbreak hasn't yet reached its peak. Now, they're expecting cases to spike once the state begins reopening. That's from next month.
We also have to accept that once we start reopening, cases will go through the roof. But it won't matter as much because people will be vaccinated. So our aim now, our strategy between now and when we hit 70% double dose is to get the number of people with COVID as low as possible and vaccinated as much as possible.
With new cases falling below 1,000 for the first time since last month, more restrictions have been eased in Sydney's worst hit areas. Time limits for outdoor exercise have been lifted. Fully vaccinated people can gather outside in groups of 5. At the same time, cases are on the rise in Victoria. It's reported its highest daily number of infections this year. And more than 560 cases have been confirmed in the past 24 hours. Danielle Robertson joins us live now from Sydney for more on this story. Danielle, cases are on a downward trend, but authorities don't expect things to stay this way.
Yeah, health authorities are warning it is too early to be complacent. The Premier saying once we start to reopen, we can expect cases to climb. And of course, the more people moving around, the more likely COVID is to spread. The difference is, though, that vaccinations are expected to keep the number of people in hospital down. While we may not have reached the peak yet, and we are going to see potentially a surge in cases, it is hoped the number of people in hospitals will stay low. And that number staying low will allow the state government to continue with their confidence in this reopening plan. But of course, reopening comes with its risks. There are some communities and some regions of New South Wales that have a population with a low vaccination rate, some communities with a high number of anti-vaxxers. And when we continue on this path of reopening, those areas are likely to be exposed. And particularly when the state starts to reopen for regional travel, it's those areas where the cracks are really going to start to show. So not out of the woods just yet.
Well, how are they preparing for what they're calling the worst month of October, Danielle?
Well, the State Premier would say that they have been preparing for this since the pandemic began, but hospital workers such as paramedics and nurses have a different story. They say that they are overwhelmed, overworked, under pressure and understaffed, and they say that they have been feeling the pinch of the healthcare system for quite some time now. There are contingency plans put in place for the worst case scenario, and what that looks like, it includes extra beds in the ICU, extra staff are being put on board. There are also plans to change the nurse to patient ratio, so they will work in nurse teams rather than one-on-one. And there are even plans to set up temporary hospitals if they are needed and if it gets to a point where hospitals do become overwhelmed and they have to shift their crisis centre. Hopefully it doesn't get to that point, but New South Wales has already survived through a number of consecutive days with cases over 1,000, so that is a window or a glimpse into what could come and what they should be prepared for. But it is hoped that vaccinations will allow the number of people in hospital to stay low and eventually allow the healthcare system to stabilise.
Danielle, thank you very much. Danielle Robertson there in Sydney.